How does the location of schwannomas lead to neurological deficits? Imagine a tiny tumor growing along a nerve pathway and how that can affect how your body works. Schwannomas are benign tumors that develop from Schwann cells, which create the protective covering around nerves. These tumors can appear on different nerves, and their location really influences what symptoms might show up. The most common place for a schwannoma is on the vestibular nerve, which is also called the eighth cranial nerve. This nerve connects the inner ear to the brain and helps control hearing and balance. When a schwannoma develops here, it is called a vestibular schwannoma or acoustic neuroma. Because this nerve is responsible for hearing and equilibrium, a tumor in this spot often causes hearing loss, ringing in the ear, and problems with balance. As the tumor grows, it can press on nearby structures, making these symptoms worse. Schwannomas can also grow on other cranial nerves, like the seventh cranial nerve, which is the facial nerve. When a schwannoma affects the facial nerve, it can lead to weakness or even paralysis of the muscles on one side of the face. This happens because the nerve's job is to control facial expressions, so any pressure or damage can cause noticeable changes in how the face moves. In the spinal area, schwannomas can develop on spinal nerves inside or near the spinal canal. These tumors might press on nerve roots or even the spinal cord itself. When that happens, symptoms can include pain, numbness, weakness in the arms or legs, and sometimes issues with bladder or bowel control. The specific symptoms depend on which nerves are being compressed and how much pressure there is. The main way schwannomas cause neurological problems is through mass effect. As the tumor grows, it pushes against the nerve fibers or nearby parts of the nervous system, disrupting normal signals. Because these tumors tend to grow slowly and are usually well encapsulated, symptoms often develop gradually. But if a schwannoma becomes large or is located in a tight space like near the brainstem, the effects can be more severe and sudden. Doctors usually aim to remove schwannomas surgically to protect nerve function, but the location and size of the tumor can influence the risk of nerve injury during surgery. For example, schwannomas near the brachial plexus or nerves in the upper arm might carry a higher chance of nerve damage. Early treatment is often recommended to prevent permanent deficits. In summary, where a schwannoma is located determines what kind of neurological deficits it can cause. Tumors on the vestibular nerve lead to hearing and balance issues, those on the facial nerve cause facial weakness, and spinal nerve schwannomas can cause pain, numbness, or weakness in the limbs. The symptoms depend on the specific nerve affected and how big the tumor gets. Understanding these relationships helps doctors diagnose and plan the best treatment to preserve nerve and brain health. Always consult a healthcare professional for personalized advice and care.